Welcome to Aesthetics Unwrapped. Today we're exploring the key differences between haematomas and vascular occlusions. Recognizing the signs early is vital for safe, confident practice. Let's break it down clearly and simply. A hematoma is a closed wound where blood collects beneath the skin or mucous membrane, forming a firm or semi-firm lump. As the blood fills the space, it can place pressure on nearby structures. While usually harmless, larger hematomas can cause discomfort or, in some cases, affect surrounding nerves or vessels if not managed properly. Hematomas may appear almost immediately following injection or needle removal. In some cases, they develop more gradually over hours due to a slow bleed into a potential space. Visually, they present as a bruised, raised, and sometimes tender mass. Though they often resolve on their own, they can occasionally become infected, requiring medical management with antibiotics, or, in more severe cases, surgical intervention. During the healing process, the hematoma may feel firm or gritty under the skin due to the natural clotting response. Fibrin, a protein involved in clot formation, creates a mesh-like structure to stabilize the area. Even after the visible bruising subsides, the area may remain textural for several weeks or even months, as the body gradually breaks down the excess fibrin and reabsorbs the blood. Yes, and this is a key reason why clinical confidence is important. Hematomas can sometimes cause delayed capillary refill due to the physical pressure of pooled blood, which may be mistaken for a vascular occlusion by less experienced practitioners. The main differences lie in color, typically purple-blue in hematomas, pain, milder and localized, and the absence of blanching or mottling. Providing clear aftercare is vital, both verbally and in writing. Here's what to advise. Apply gentle pressure at the site immediately after bleeding to reduce spread. Sleep on your back or the unaffected side for the first night. Rest for 24 to 48 hours and avoid exercise steam rooms or saunas. Apply a wrapped cold compress or frozen peas for 10 to 20 minutes at a time, repeating regularly for the next few days. After 48 hours, switch to warm compresses to support reabsorption, use topical treatments such as arnica for the next few days, and use paracetamol if needed for discomfort. Don't apply ice directly to the skin, always wrap it to protect the area. Don't massage or rub the affected area, particularly around delicate zones like the eyes. And don't stop taking prescribed aspirin or blood thinners without consulting a GP. A vascular occlusion occurs when dermal filler is accidentally injected into or compresses a blood vessel, most often an artery, restricting or blocking the blood supply to tissues. This prevents oxygen from reaching the skin and can result in tissue damage, necrosis, or even vision loss if not recognized and treated promptly. Unlike hematomas, VOs are medical emergencies and require urgent action. VOs can occur instantly during injection, or symptoms may appear and progress over minutes to hours. Common high-risk areas include the glabella, nose, nasolabial folds, and lips, regions where arteries have limited collateral blood supply. Even small volumes of filler in the wrong location can have serious consequences. The most common causes include intravascular injection of filler, compression of a vessel from surrounding product, external pressure in areas with minimal vascular redundancy. Early recognition is crucial. Unlike hematomas, which tend to bruise and swell, a VO often presents with blanching, pale or white skin in the affected area, delayed or absent capillary refill, mottled or net-like discoloration, severe disproportionate pain that worsens over time, cool or cold skin temperature in the affected area, and skin breakdown or necrosis if left untreated. These signs can evolve, so continuous monitoring during and after treatment is essential. Always err on the side of caution. Without timely treatment, vascular occlusion can lead to skin necrosis, scarring, and disfigurement, or blindness if filler enters the ophthalmic artery. These outcomes can often be prevented with early detection and appropriate response. If you suspect a vascular occlusion, immediate action is vital. Stop injecting immediately and calmly explain the situation to your patient. Massage the affected area to help disperse the filler. Apply warmth to encourage vasodilation. Administer 300 milligrams of aspirin, if not allergic, to inhibit platelet aggregation and help reduce the risk of clot progression. Assess capillary refill. These steps alone may sometimes restore circulation. If using a hyaluronic acid filler, inject hyaluronidase liberally in and around the area, following your pre-prepared hyaluronidase protocol. Continuously reassess capillary refill and document everything carefully, including clinical photographs. Refer appropriately and urgently if there is any uncertainty or if symptoms do not rapidly improve. Remember, time is tissue. Early intervention, ideally within 60 to 90 minutes, is critical to prevent irreversible damage. Don't ignore patient-reported pain or unusual symptoms. Always assess color, capillary refill, and skin temperature. Don't assume it's just bruising. Don't delay treatment if you suspect a VO. Waiting to see how it goes can lead to irreversible tissue damage. Don't apply heat immediately without first assessing for occlusion. Warmth can be helpful, but only once a VO is confirmed and active management has begun. Prevention is key. While no technique can eliminate risk entirely, you can significantly reduce it by knowing detailed facial vascular anatomy, injecting slowly and using minimal pressure, using blunt cannulas in high-risk areas where appropriate, aspiration, though not always reliable, being trained and confident in VO management and hyaluronidase use. After managing a VO, patient care doesn't stop. Ongoing monitoring, follow-up, and documentation are essential. Emotional support and clear communication are also critical. Patients may be frightened or distressed, and your reassurance can make all the difference. Thank you for watching Aesthetics Unwrapped, where we empower confidence through knowledge. Don't forget to like, follow, and subscribe for more beginner-friendly aesthetics content.